You may be surprised by this statement. Sure, it's important to reproduce the pain of headache when examining the upper cervical segments, but reproduction alone does not confirm relevancy. At best, it would make you highly suspicious that you are dealing with relevant cervical involvement in a headache or migraine process. Reproduction and resolution of referred head pain and or associated symptoms as the technique is sustained confirms relevancy. Let me take you through the rationale. Here we have a sensitised brainstem, and in this situation the brainstem is sensitised because of lack of inhibition or disinhibition, perhaps because of insufficient level of serotonin, or there's an issue with the diffuse noxious inhibitory control system. Now in this situation, will you reproduce the pain of headache? Yes, you will, and if you're relying on reproduction alone, you'd be thinking, yes, I've got cervicogenic headache, but clearly this is not cervicogenic headache. As you sustain the technique, do you think you're going to get resolution? Will resolution occur? No, it won't, because you're not changing the reason for the sensitisation. The reason for the sensitisation is a lack of inhibition. Similarly, if you've got a sensitised brainstem as a result of noxious trigeminal afferent inflammation, for example from a tumour or an infected tooth, will you reproduce the pain of headache in this situation? Yes, you will. And once again, if you're relying on reproduction alone, you'll be thinking, yes, I've got cervicogenic headache. But once again, clearly this is not cervicogenic headache. And once again, will resolution occur as you sustain the technique? No, it won't. Because you are not changing the reason for the sensitisation. The reason for the sensitisation is coming from the trigeminal system. Noxious afferent inflammation from the trigeminal system is sensitising the system. You are not going to change the reason for sensitisation. So the referred head pain, the referred symptoms stay the same as you sustain the technique. If you have sensitisation as a result of noxious cervical afferent inflammation, yes, you will reproduce the pain of headache. And yes, resolution will occur if you're doing the technique well. So reproduction and resolution confirms relevancy. Whilst reproduction alone will make you highly suspicious of cervical involvement in headache or migraine, resolution confirms this for you.